house calls for healthcare. So I would get a lot of clients requesting for delivery of drugs. Some who wanted to do some lab tests, they were not able to go to the hospital, especially the elderly patients. So initially that's what I used to do, just you call me and I would go and do a bit of medical checkups as well. So around 2021, then we registered this one as a full company, and we started making it a bit more systematic to formalize it. So how it works right now, we developed a web-based application where you're able to download it and you register as a patient and then you can request for the listed services that are there, the ones that I've mentioned, the home-based medical consultation, nursing care, even family planning. So all these things that can be done that don't require hospitalization, be able to do them at home. So it's a two-phase kind of application, because we also have medical doctors, nurses, physiotherapists, and some lab technologist assistants who also just register on the platform, and then when there's a request for services, you pick the one that's nearest to you. If there's a request for home consultation and it's in Tomboya, for example, then the nearest doctor at Tomboya will be able to attend to you. We have a lot of physical hospitals, and this traditionally, the services that are offered the way they've been done traditionally. You know, you go, you register, you wait to see a doctor, you wait to go to the lab, you wait to go for imaging and such things. So you find even if you had a simple ailment, the process becomes too tedious. There's a lot of time lost from the time you're checking in a hospital and the time you're checking out. Mm-hmm. So that's one of the gaps that really is there, because it's traditional. It's the same old way, and yet these doctors, these nurses are people that we're living with. They are our neighbors. So then we just thought, why can't we capitalize on the resources that are within us, so that then we are able to save people time. Your employer could be not allowing you to go and seek medical attention, but after work you can go and someone comes and attends to you in your house without really losing so much time, and you'll get all the services that you want. If it's medication, they will be prescribed, as at the comfort of where you are. If it's lab services, you're working with a lot of delivery people, so the samples will be taken, there's an assistant who will come for the sample, and your test will be sent back to you.